All right, our audience is starting to stream in. Welcome everyone to winning the share of wallet of consumers in your market. My name is Adam Rubenfire. I'm a content strategist with Modern Healthcare. I'm thrilled to introduce our session. With the majority of care occurring outside the four walls of health systems, the battle for winning the share of the wallet of consumers upstream has never been greater. Executives from our premier sponsor, Patient Technologies, will address the financial burden on consumers and health systems today, how health systems can adopt new payment models to meet consumers where they are, and practical and attainable strategies to engage consumers for the long term. Now, I'm thrilled to welcome Darius and Andrew, who are going to be giving the presentation today. I'll hand it off to Darius to get started. Darius?
Adam, thank you very much for that introduction. And firstly, thank you to all the attendees for joining. By way of introduction, my name is Darius Cherzad. So I'm the Chief Commercial Officer for Patient. We offer, what you can think of as kind of a buy now, pay later capability for healthcare services that we're typically pairing alongside either employers' benefit solutions or health plans more broadly. And so I'm here with my colleague, Andrew Harris, and he leads our work with providers. And we're excited to share our perspectives on what we think is going to be a compelling opportunity for providers and health systems writ large. And so before we sort of go into it, I was hoping to just take a minute to kind of set the context for what we're going to share. And so our objective is obviously to share that perspective. And so, in doing so, we thought it was worthwhile to just recap a little bit around how sort of what the current state of the world looks like from the provider's perspective. And so the key kind of points are, your most attractive consumer segment, commercially insured individuals, they're facing a ton of headwinds, right? There's a shift in high deductible plans. More generally, that commercially insured population is shrinking. That was a little bit compounded by COVID. And then secondly, there's a ton of kind of internal and external pressures on the providers themselves. And so more competition, less inpatient visits, frankly, changes in how sort of care is consumed and purchased. And so most of the tactics that we've seen providers taking to kind of respond to these are happening downstream. So, after the event, after service, and at the best case, perhaps it's pre-encounter. And so I think the headline we want to sort of lead with here is that we think there's an opportunity to actually go upstream in a way that can create value to providers, improve revenue, and improve sort of collections on the back end. And so we'll talk a little bit about all of this as part of our agenda today, where I'll hand it off to Andrew, and he's going to talk us through, firstly, a little bit more of that kind of provider and member context, but in a lot more detail. I think second is share a little bit about what we think, practical opportunities for going upstream look like and feel like. And I think thirdly is, our frankly outside-in perspective on what that opportunity is for providers. And so, without further ado, I'll hand it off to my colleague Andrew and let him take us through it.
Darius, thanks so much for that introduction, and thank you for Adam for the the conference the last couple of days. This has been a great opportunity to meet and network with different folks. I've been a big fan of the network carousel. It's been pretty cool to be a part of the last couple mornings. I think as Darius was alluding to, I think what might make the most sense just over the next few minutes is first spend a few minutes looking, number one, at the consumers today, the financial side and the burden that they are facing. Second, look at those providers and understand the providers from their market, the challenges that they're having, and then being able to give one or two good takeaways today on how to really increase the consumer share of wallet further upstream. So I loved just a quick observation yesterday. I was listening to Jeff Johnson, and he was talking about he's the vice president of innovation. I think it was at Dignity, and I'm paraphrasing here, but they were asking him about the impact of COVID and what that has done on the provider side today. And I loved Jeff's response where he said, from an innovation standpoint, COVID, given all the challenges that has been over the last 13, 14 months, he said it's really accelerated the engagement process to really think differently about how, to connect with consumers. And Matt Herman at Ascension actually made the same observation today during his call about that acceleration, mindset. And so I think as we kind of go through this story over the next few minutes, kind of look at this discussion today, you'll see why acceleration is so pivotal, because coming out of the fog of war of COVID and hopefully being able to see, opportunities downstream to look at opportunities as we put the pandemic hopefully to the rearview mirror in some ways, there's really an opportunity to accelerate, the way we engage consumers. So let's first of all just start off here right out of the top. I think when we look at the current financial state of consumers and market trends, this was a slide that was published by the American Hospital Association, and many of you all are familiar with these models, but I think it's important to link, the cause with the effect and the solution. And when we think about the distribution of health insurance here on the far right, this enrollment period from 2005 to 2019, it's a really telling stat that really talks and speaks directly to the rise in high deductible health plans from the inception in 2005 all the way through 2019. In fact, if you look on the far right side here, you can see this growth. Check this trajectory out here. Over 32% growth in high deductible health plans from percentage of totally, commercially insured lives over that period, just since the inception of the high deductible health plan. And so what we're seeing is really this cost sharing is increasing for consumers, but the folks that are really feeling this impact are really threefold, right? Number one is obviously the provider. Number two are the employers, which we'll talk about here in a little while. And then, number three is obviously the patients. And when we think about these high deductible health plans, again, just to orient, these high deductible health plans, these plans provide the most flexibility to manage your healthcare costs, but typically will offer a lower monthly premium, but then require you to reach, that deductible before your benefits, become effective. And so, based on this trajectory right here, it probably doesn't take a rocket scientist to figure out that this trend is probably not going to change anytime soon. And I think our forward view of this right now is that as this trend continues, what is going to be the what's going to be the challenge from the consumer side as they take on more of that financial, burden, if you will? What's going to be the action that they take? I think the second piece to look at here as well is looking at the consumer as it relates to the way they are paying for care, and what are some of the stories that we're seeing today as this trend continues with the rise in high deductible health plans. So you can see right here, this slide right here really demonstrates two trends that are extremely sobering. Number one, providers are not getting paid, first and foremost. But number two, when the consumers do pay, they end up paying extra when they do through, personal loans, GoFundMe accounts, all of these things on the right-hand side. And so because of this, there's really three outcomes that are really real symptoms of this issue. Number one is that, people get the care they want or need, but they take on debt to pay for it. Number two, folks do get the care they need, but then they're just not able to, pay the provider. And so, this $200 billion of unpaid costs really becomes a system-wide issue that's created where if the provider doesn't think, right, that they're going to get paid, this ultimately affects their prices, which then ultimately come back to increased premiums. And we end up having this kind of financial spiral that ends up ultimately really serving no one and comes right back onto the shoulder of the consumer. And then the third outcome of this is, and this is probably the most poorly, understood yet most significant, is the fact that they are not getting the care they need at all, and simply defer that care altogether. And so when you think about this, coupling the data we just looked at with this rise in high deductible health plans, and to think right here that 81 million, right here in the middle, 81 million people have fewer savings than their deductible. It's really no surprise that $200 billion of that are unpaid, with 85% of those dollars having to come right from credit cards and these personal loans. And I think what's fascinating, as we've kind of been preparing for this conversation today, I've had some anecdotal data points that really speak to kind of the post, I won't say fully post-COVID world, but as people are beginning to go back to work and looking at the data that's being collected, it's pretty fascinating. Some of the data points that are coming out over the last couple of months about just the impact that the consumer is feeling and how COVID has exacerbated a lot of these challenges. Kaiser Family Foundation came out with a poll, a tracking poll, that said that more than a third of Americans say they've struggled to pay living expenses just since December. So more than a third of Americans say they have struggled to pay just basic living expenses just in the last 6 months. 37% of Americans, get this, 37% of Americans say that someone in their household has had trouble paying just for basic living expenses over the past 3 months also. So these are, this is really the world today now. The consumer, when they're thinking about healthcare and they're thinking about what's happening in their wallet and the choices they're making, this is really the reality of where they are. And so the question is, what is the provider, as the trusted advisor in the community, what is the provider looking to do to help meet these consumers where they are? And even before we kind of talk about that, I think it's also important to now look at the other side of the coin and say, what is the impact that is happening on the provider side, given these challenges as well? And so the first, I think the highlight here on this slide is number one, providers must adapt to increased call sharing with consumerism and then obviously new competitors entering into their markets. You'll see on the far left-hand side here, we see consumer adaptation. And then we see in the middle external forces, and then on the far right, you have the internal forces that are happening. And going back to the consumer side for a second, when we think about the way that consumers are looking at shopping for care and consuming healthcare today, it's pretty telling when you think about that. There's a statistic that came out from Access One, who does a lot of revenue cycle management, et cetera, but they said that, and this was even pre-COVID, that 2 in 5 consumers today said they would actually switch their provider based on the payment model that was more affordable. So 2 in 5 consumers would actually switch their provider based on the based on the payment model that was being offered. And so I think that is going to continue to be, a moment where people are going to ask, where is this the best option? How is this convenient for me? Is this the right, should I, go ahead and get this procedure done right now, or should I wait for it? So these are the things that we think about when we're thinking about where the consumer is today. The middle piece here, and for our provider friends here, you definitely understand this. When we think about the external forces the providers are facing right now, the challenges, the ambulatory care setting is absolutely going crazy right now. That we think about the way that the outpatient market is growing exponentially. When we think about Walmart, surgery centers, the role that payers are playing, it is really like the Wild Wild West. I was actually on a call last year with somebody on a managed care team, and they were telling me that they were sharing that one of the local payers was actually out in front of one of their Walmarts, and stay with me on this one, was actually out in front of one of their Walmarts giving coupons to direct care to their outpatient facilities, away from their health system, essentially. And it really is amazing when you think about the way the outpatient market is growing today. There's some really interesting statistics that I think we'll only continue to see this battle even being won, this battle just growing more and more, which is the U.S. Bureau of Labor and Statistics says that by 2028, there will be 3.4 million new jobs by 2028 in the healthcare and social assistance sector. So 3.4 million new jobs by 2028. Half of those 3.4 million will actually be in the ambulatory care service space. Out of that number, only about 350,000 will be in hospitals. So it is. This is a battle when we think about the winning more consumer share of wallet. The battle is really being won on this ambulatory outpatient side. That is where the focus really is. And I'm actually going to take a pause here for a second because I'd love to get y'all's feedback. When I've been doing some of the other, listening to some of the other presentations, discussions, I love the chat feature, that's available. So I would love to get y'all's perspective on this. What in your particular community, and whether you're a provider or not, I would love your perspective. Who is the biggest threat you think in your community to the share of wallet of a consumer? So who do you feel like is the biggest threat? Is it a payer? Is it a provider? Maybe surgery centers? I'd love if you guys can maybe give some feedback to that. That'd be awesome. And Darius, if you want to jump in, man, and give some color commentary to those that respond, that'd be awesome. Yeah, we actually had we took a survey last year that actually talked about, last 2 months ago, last month, about looking at who was the greatest competitor in markets. And most providers actually still in about 150 finance executives said their biggest competitor was still another provider in their market, which is pretty fascinating.
And Andrew, maybe we can sort of keep the discussion flowing, and as the questions come in, we can sort of circle back to them. But I think your point is exactly right. Like a lot of the themes and external forces we've listed here, so folks like Optum, folks like the ASCs, frankly, in fact, the payers showed up pretty high on that survey. Interestingly, despite a lot of, I think, fanfare in the media, I think the topic of sort of the Walmart foray into the provider space wasn't top of mind for a lot of providers yet. But I think, look, our perspective is it's probably a matter of time on that one, right? And so I think that's probably a place to watch.
I think that there's actually, in fact, this is interesting, that there's going to be a session, actually, I think later this fall, that Modern Healthcare is going to be doing. I don't know if it's a webinar or something, but I know that in our preparations for this conversation, they said that they're actually going to have somebody from Walmart on, and they're going to be talking about the phrase, Darius, is the headline there is, "What if you were to run your hospital like Walmart?" Which I'm definitely listening. So if you look here on the far right, when we think about the internal forces that are happening today now on the provider side, Kaufman Hall came out with some really interesting data that said that the median hospital operating margin at the end of 2020 was 2.7%, and that included the CARES Act funding. So it was a 2.7%, including the CARES Act funding, which was actually down 56%. And the other piece, and a lot of conversations we've had recently, is also with hospitals that are in more rural communities, right? Right now, per Chartis, they say that 453 hospitals are in danger of closing, with the majority, 77%, having 33 days or less of cash on hand. So 453 hospitals right now have, of those 453, 77% have 33 days or less cash on hand. And so it really does create this scenario from the provider side now to say, okay, well, how do we go? What are ideas? A, where is the battle being won today? But B, what are some tactical ways that we can look to win the share of wallet of these consumers that are being bombarded really further along by these outpatient influences, while still making sure the provider gets the margin and the commercial revenue they need. And so kind of our philosophical approach to this and tip of the spear is saying, look, in order to do that, you have to win the battle upstream. The provider, the traditional way of looking at revenue cycle management and things like that are certainly appropriate and needed greatly right now, right? When it comes to those where consumers are. But those are also things that are done more downstream. That's after a patient registers. The battle really, even before that, is happening upstream. It's happening in that outpatient space. And so in order to compete and thrive, hospitals need to begin to think about what are ways and upstream solutions, ideally in the way that you can really meet those patients where they are, by literally putting your hospital in their purse or their wallet to make sure that you're enhancing patient access to care, growing that outpatient market share, generating the loyalty of those consumers, and making sure that there is a way there that when they think about your hospital or they think about services, they think obviously about your hospital. And so what does that mean? What does that really look like? So if you see here, we have two kind of actionable opportunities that we believe are really important and thoughts to consider. Number one is actually, don't forget that the consumers for a hospital is not just people that are in your community outside your four walls. The consumers are also actually the people that work first and foremost at your hospital, your own employees. We've had a lot of conversations with different providers that unfortunately have been in a situation where, in order to help create loyalty and employee loyalty, they've had to write off a lot of bad debt from uncompensated payments for their own employees not being able to pay their out-of-pocket responsibilities for their services, and has ended up just writing that off. We believe that there's actually some ways to do that in a dignified manner that we'll talk about in a second here. The second place that we believe further upstream as well is to go directly actually to employers. We really philosophically believe, given our experience, that the anchor, if you will, to be able to really connect the provider with that consumer and that commercially insured life is actually through the employer. And we'll talk about what that looks like further here in a second. But let's first of all go back to the internal opportunity for providers and what that really looks like. And what we're talking about here again is increasing voluntary payments for out-of-pocket services amongst health system staff, where basically looking at the idea of realizing that look, there is an opportunity here to connect their own employees with health payment cards that have funds available to help pay for the opportunity to pay for those out-of-pocket expenses, medical, pharma, dental, whatever that might be. Our data would actually suggest, based on our discussions, that this really equates to a bad debt opportunity of about $1 million per 1,000 benefit eligible employees. And so when you look on the far right here, you can see this is an illustration of a 10,000 person health system. And what our approach has been to looking at this number and quantifying that opportunity is number one, just estimating the total out-of-pocket spending at a hospital, cutting the portion that occurs outside the hospital to truly get at that domestic spend. And then last would be conservatively to assume that only about 50% of that is collected to really get to that opportunity. And we say that we say conservative because many CFOs and RCM managers even say when it comes to their own employees not being able to afford, or being able to pay their share for out-of-pocket costs, their collection rates can be as low as 30% even. And so you can just see the opportunity here of about an $8 million to $11 million waterfall that occurs through a hospital not being able to help collect that those payments as well. And we think we can do this in a dignified way by providing a win-win solution for the employees, the consumer, who's again not exempt from the challenges we just talked about, the first two slides, by being able to provide basically interest-free financing to be able to go to them directly and say, look, you can simply have this as an opportunity to increase these payments for you and your family, and doing so in a way that provides dignity, and respect, while kind of de-risking the tension and the financial responsibility that occurs in this kind of uncomfortable conversation sometimes. So that's really the first thing is looking at the employees as the consumer at your own hospital, is looking at the opportunity to provide a way to help increase voluntary payments for those out-of-pocket services. The next strategy, if you will, that we look at when we talk about winning more commercial share of wallet of a consumer really goes, as we said, further upstream to the employer market. And I think just for context as well, so our marketing team, fantastic job on this. They've actually put a QR code here. I'll highlight it. A QR code here. If you would like a similar analysis done, either for your hospital, like the internal analysis to look at the bad debt opportunity, or you want to look at more of the employer market analysis, all you need to do is just get your phone and then put it up to the QR code there, and it'll populate. And then we can get you an analysis similar to this to give you an idea on what your opportunity looks like for your particular market, if that'd be helpful for you. The reason we're doing that is because there's a lot of people that we speak to today. Actually, I was on a call at 9 o'clock this morning that we were talking about this with a system in the Midwest, where they've traditionally worked with a handful of employers, right? There's 4 or 5 that they know of. But many hospitals do not really understand the true depth of their employer market, because they just simply either don't have the data or they just don't have the focus as much to really understand the true value there, right? And so what we've done here is we've oriented, just to quickly here, orient for the New Orleans market. And so we pulled some data on New Orleans and really looking at 3 things here. Number one, the number of employers by employer size. Number 2, the number of commercial patients by employer size here in the middle. And then last, and this is fascinating, looking at the total spend by employer size. So looking at the out-of-pocket spend of an employee plus the value of their commercial insurance, what we deem to be about $7,000 per consumer. And so there's a couple of highlights and observations from the New Orleans market here that I think are interesting. You look here, you see the 24 employers between 2,000 and 5,000. I think what we see to be true the most is that most of the time, the sweet spot to connect more with consumers is in the employer, really the employer market from a number of employees standpoint, is really between the 250 to 2,000 range. That is really the sweet spot, if you will, for people that are employers that are willing to engage and look at doing some type of, not even just simply a contract arrangement, but even just to look at some lighter partnership initiatives around clinical services, screenings, et cetera. That 250 to 2,000 sweet spot is really critical. And I think if you look here in New Orleans, there's over 144 companies that we would deem to be really good sweet spot to be able to help connect your hospital with those employees. I think the other piece here to call out is when you look at the total spend by the employer sides, it is pretty staggering to look at the opportunity that is available within just being able to go directly to a consumer with basically interest-free financing to be able to tap into that $7,000, opportunity to be able to say, look, hey, we're here to help provide access to care for you, the consumer, and being able to do so in a way that financially can still be good for the provider while also meeting the consumer where they are. You can see the financial opportunity just in these just within this employer analysis right here when you look at the New Orleans market. And then I think the last piece here that's important to note is, a lot of people, when we think about, employers, a lot of folks think about narrow networks and direct contracting and all those things. And those are good things to do. I think sometimes, though, where providers miss the mark is the majority of people actually don't do that. The majority of employers aren't interested in doing a rip and replace model unless it absolutely makes sense. But what they are interested in doing is finding ways to simply, have services available for their employees. And we really see that as an opportunity to also be able to connect more with those employers as the trusted advisor in the community the provider is. That even if you don't have a health plan or a narrow network, simply having a conversation and understanding what your opportunity is in your community can go a long ways to winning more commercial revenue and winning that share of wallet of consumer that everybody's fighting for right now. And so just one last shameful plug. Go ahead, if you want analysis, go ahead and go on that QR code as well. Click it with your phone, it'll populate to you. We can prepare a similar analysis as well for you. We also have it in the virtual booth as well. We've gotten actually about 4 or 5 today of people coming by and wanting to see kind of what their total market opportunity looks like. And then the last piece on this as well, when we think about the employer size, is you might need to lean in a little bit because the lettering might be a little bit smaller. But there's really 3 things as we peel back the onion here. Yes, it's important to know the employers, the sizes, et cetera. But even within that, right, and a lot of you all are familiar with this, there's insurance carriers, there's benefit brokers, there's even renewal cycles when it comes to their experience and when they're looking at adding on new benefits and so forth. I went ahead and we pulled just 5 employers here. But if this kind of data would be helpful for you, again, do the QR code. We'd be happy to prepare analysis for you. But the benefit brokers in these communities really do go a long way to helping the employer, be able to connect with your services. And so my recommendation would be find out who these brokers are, because the brokers, these employer benefit brokers, are the people that those companies look to really ask advice and really understand what the opportunity is. Some of you might have already have some data on brokers. Many of our conversations, they don't. But again, if that would be helpful, happy to prepare some information for you and your team on this. The second piece is the insurance carrier. Who are the insurance carriers, right? Who is it? What are those commercial plans that one employer might have that another one might not? And being able to know based on your pricing and your strategy from a managed care perspective, are there certain employers that are better to reach out to, maybe that are going to be put you in a better position? And then the last piece here is going to be the renewal cycle. This is really a really busy time for us as our company in us working with providers and employers, because they know that the renewal cycle is coming up at the end of Q3 and Q4 to be able to look at new alternative models to offer benefit plans or benefits back to their employees, right? And so people are interested right now, benefit brokers are, employers, at looking at new ideas and how they can partner with other people to help reduce those costs. The renewal cycle is really pivotal in our experience of really being able to know the timing of when those are, because while these are all illustrated for January, there's actually quite a few people that are off cycle as well that are in July. And wouldn't it be nice to be able to know who is where and who is when, and when you need to be having those critical, conversations. And so the last piece here, I think that's important to know when we talk about winning more of the share wallet, whether that means going directly to employers or that means looking at opportunities within your own health system to be able to, for your own employees and your team members, regardless of what it is. Winning the battle upstream is so critical, because when we win the battle upstream, there's really four things that can happen. Number one, obviously we provide greater access to care. Number two, this really creates a ripple effect downstream, back when we think about the idea about revenue cycle management and so forth. When we're able to get the commercial revenue on the front end, it really creates some more financial security downstream for the provider. And number three, there's also a lot to be said, as I referenced earlier this call today that I had with this system in the Midwest, that this whole fee for service of value-based care and population health management, that being able to increase the access to care really affects a lot of these things when you think about the clinical side and the population health management. And I think it's been our experience to say that, yes, even though, like we looked at that second slide, we don't really know the impact of the people that don't access care. But what we do know is when you do allow people the ability to access with available funds, they will use them, and they will use them consistently. And so this really creates really a virtuous cycle, if you will, for consumers that begins on the upstream side, but then trickles downstream, across the care continuum, that can really make some significant headwind in a positive way to win more share of wallet for consumers. And I'll stop sharing right now.
And we'll sort of we'll kind of recap our takeaways and things to close. But first of all, I wanted to thank you all for just joining the session, being a part of it. And second is, this would probably be a great time if there's questions from the audience or things folks would like to ask. We'd welcome that discussion from the audience members as well. Adam is informing me that no questions so far.
But I have a couple of questions watching your presentation. I'm just curious. I think one of the things we talk about, with health systems is the importance of the patient financial experience. Health systems want to get paid, and really, frankly, want to get that as quickly as possible. And I don't know if it's something that's been as significant a part of revenue cycle traditionally as it is today. And I'm just curious, Darius, how you think that plays into this vision here. And and if it has anything to do with why why you're kind of looking to solve this problem. Because like you said, people are paying a higher share of the cost of their care, and we're just dealing with, even if it's not full self-pay, we're dealing with a lot more self-pay. I mean, myself included. I have a high deductible plan, so I'm just curious what you think, Darius.
Yeah, I mean, a few thoughts on that, right? So I think first is it's a challenging dynamic for providers, in part because of the reputational risk aspect, right? I think yesterday I was reading a piece about there was I forget where this system was. I think they might have been based in Tennessee, but they brought a bunch of lawsuits against clients, against members who owed out-of-pocket bills during COVID. And I think the number was something like 10,000 members or something they'd sued. And so that's a bad look for a provider. Certainly no hospital CFO wants to have that sort of things tied to this. But at a certain point, when the problem reaches a scale and it's kind of unaddressable, that's the only option left to the providers. So it is a bit of a rock and a hard place type situation. If you let the problem, frankly, right, fester and continue to grow, and then you're really out of options in terms of what you have to do, right? Because then it's talking about wage garnishing, pieces like that. And I think because it's become so binary in a way in terms of the options available to providers, where it's like do nothing or take rather extreme actions that put you at reputational risk. We think that makes the case for doubling down on kind of trying to touch these folks earlier, right? And just by nature of the way the system is constructed in the United States, the employer is the source for that care. And so when we talk about going upstream for the health systems, we think really that's the right port of call. And so feeding in an out-of-pocket financing mechanism as part of the overall offering that providers are taking to employers, we think that's a compelling story for the members. We think it's a compelling story for the providers, and we think it's a way to address a problem, frankly, before it becomes one. And so I think that really, Adam, in our mind, is the opportunity, right?
Yeah, I won't name names, but I read the same article. It's a for-profit health system, one of the largest. So we'll just leave it there. But yeah, yeah, it's significant. And Andrew, I just wonder, is this, we know that
it's not a good look. Yeah.
Oh, go ahead.
Yeah.
Sorry, Darius. I might have interrupted you. Oh, we might.
No, not at all.
Yeah,
go ahead.
Just, one of the things we hear from providers all the time is the challenge of if we give providers a chance to complain about anything in a survey or something like that, payer-provider relations unfortunately come up constantly. It'd be better if we, just didn't have to deal with them. And that's unfortunate, because we all know that this ecosystem in the U.S. is important and works, and frankly, realistically, it's not going away.
Right.
So Andrew, I'm just wondering if you have any thoughts on like how this, how this kind of idea could play a role in shifting payer-provider relations, or at least easing kind of some of the frustrations that providers have.
Yeah, well, I mean, that's a big question for 60 seconds, but I'll do my best.
We can go all over, no problem.
Right, it's a good one, man, and it's the right question, because unfortunately, you're right, the payer and the provider, that has not always been an acrimonious relationship, right? And I think it is interesting I think what we're trying to come at it, maybe one particular perspective out of it, we're trying to do is we're trying to say, hey, look, if you know from the provider what you're receiving from those particular consumers based on leveraging a health payment card or something alike, and you have the data to show that, wouldn't that help you to then be armed in those discussions with those payers as well, right? And so I think that's at least one part that we've had some discussions with folks on, but obviously there's a lot of different layers to that question, right?
Yeah, absolutely. Well, go ahead.
I I might even build on that a little bit if we could.
Yeah.
I mean, look, from a philosophical perspective, right? Like, this is a place where the providers and the payers are aligned, right? The payers should want the providers to be able to collect on that out-of-pocket responsibility, and certainly the providers want to collect on that too, right? And so our view is that if this is a place where, whether it's originated from the provider side or whether it's originated from the payer side, right? If a solution can be reached or a solution can sort of thread the needle of helping the provider, then that's good for the payer too, right? In part because it shows their sort of capacity as kind of a partner that's willing to help the provider with a real pain point. But then two is that from an economic or financial perspective, right, those unpaid balances show up in the rates. And so the extent to which payers can be an active participant and a proactive participant in helping the providers collect on those, that should flow through as an economic benefit to them in the form of potentially lower rate reductions on a go-forward basis. And so we really do see this as a place where the incentives between those two parties, which to Andrew's point, sometimes have been acrimonious in sort of recent years, this is a place where you're solving the same problem. And so it's good for sort of everybody participating in it.
Yeah. Well, thank you so much. Yeah, the idea that why prices are high and that being a part of it is something that I think a lot of us know, but consumers don't necessarily,
right.
Get to know. So thank you so much to all of you, to both of you for such a great presentation. And that brings us to the end of the session. Thanks to our audience for the questions and for listening. Thanks to Patient Technologies for sponsoring. Thank you so much, Darius and Andrew.
Thank you, Adam, and thank you, everyone.
Thanks, everyone. Thanks, Adam.
Thank you.